Hi, everyone. I'm Steve. I'm here with Dr. Nario, who has a different background because he's in Arizona at, what are you, at some type of a medical
Yep.
clinic?
So, I'm in the Andrew Weil Fellowship Program here at University of Arizona, and this is the number one fellowship for integrative medicine here in the United States. I'm very honored to be here, even though we have a change of background, but I'm with amazing people. I'm with rheumatologists, cardiologists, all the specialties who are trying to jump into integrative medicine. And the luck of the draw is I'm already in integrative medicine. So as you can see, the role reversals here. I'm very honored that they always come to me and ask me questions about what integrative is, and I'm pretty happy to share with these great minds that are here today.
That's awesome. I know what it is.
You see, they'll ask you more
So,
questions too.
Integrative, Dr. Nario is with Integrative Health Center in Reno, Nevada. If you want to see what they do online, you can go check them out. Biointegrative Health Center, Reno, Nevada. So, thanks for being here, Doc.
Thanks, Steve, for having me again. Always a pleasure.
So, we're going to talk about a peptide again. Peptides are all the rage. I say that every week. We're going to talk about LL-37. So, tell us what it is. It's a short chain of amino acids. What is it, either 4 or 7?
Yeah, it is. It's actually, Steve, is it's something probably I don't know if it's not one of the more famous peptides out there, but your immune system uses it every single day. It sounds like a military drone, a highway, or a Star Wars robot, but LL-37 is actually one of your body's most powerful natural defense molecules. Spoiler alert, though, as we age, we tend to make less of it, which explains a lot. We call this antimicrobial peptide. Translation into normal English, it's a natural antibiotic that your body makes. But it's better than antibiotics because it doesn't cause resistance. It doesn't wipe out your normal flora, like your microbiome. It does not, I guess, it does more than kill germs. For example, it actually is actually an anti-inflammatory. It also heals tissues for you, and it's made by your natural cells, like your immune cells, your skin cells, gut lining, and even lung tissue. So basically, anywhere the outside world tries to invade, LL-37 shows up for you to protect your system. So think of LL-37 as a bouncer, a cleanup crew, a repair technician, all rolled into one molecule.
Yeah, peptides are awesome. I mean, your body makes them and they're signaling mechanisms. And this is one found in the body, right, that your body makes.
Right? Correct.
Yeah, just like you said. Okay, so can you talk a little bit about the benefits? Who would take this?
Right. So, Steve, LL-37 has four big jobs here. And this is where the anti aging magic comes into play. So, it kills bad bugs. That's number one. 37 punches holes in bacteria, viruses, and fungi, and it does this without harming your own cells. Your immune system basically says, not today, microbes, but LL-37 will just finish the job for you. Number two, it controls inflammation. Not too much, not too little. So LL-37 is smart. It turns inflammation up when needed, when you have infections. It turns inflammation down when it's excessive. So that matters because chronic inflammation inflammation leads to aging. And of course, when you have aging, you have disease acceleration. LL-37 helps prevent your immune system from acting like it's permanently angry at life. Number three would be repair tissue. LL-30, skin wounds, healing. Repair the gut lining, supporting blood vessel health. In anti-aging terms, faster repairs equals slower visible and functional aging. So if your body were a house, LL-37 is the handyman that shows up before things fall apart. So another one would be talking to your microbiome. LL-37 doesn't kill just bacteria, it shapes the ecosystem, the bad bacteria in the gut. It all for it suppresses harmful microbes, so it prevents the growth of bad bugs, allows beneficial species to thrive, maintains balance instead of sterilization. This is why it is important for gut health, skin health, and immune tolerance. And in the light of aging, so here's the uncomfortable truth. As we age, L-37 production declines. So bare tissues weaken, infections linger longer, inflammations becomes chronic, and LL-37 is associated with poor wound healing, skin aging, gut permeability, meaning leaky gut, higher infection risk. So aging isn't just wear and tear. It's loss of protective signals, and LL-37 is one of them.
And you said it kind of, well, it doesn't really mimic, but it could take the place of an antibiotic, and we'd get the same benefit. But antibiotics, it's like, for me, I try not to take them ever.
Right. Well, that the one you mentioned, that really how it works, it actually disrupts the membranes of all those species that are or microbes that I just mentioned to you, and will lead to leakage and cell death. So
That's
its
how
effect,
antibiotics work.
right, and also it does the same thing. And the beauty of the LL-37 is that it actually is synergistic with your conventional antibiotic. So, for example, if you want something to be sped up. Rather than you taking 7, 10 days of antibiotics, you just want to do it 5. You could add your LL-37 along with that therapy to create that protocol so that we know as we drop those bombs in the microbiome, there's definitely a lot of destruction of removing good bad bacteria. And also, when you talk about using antibiotics more often than the usual, you also have this ability to develop resistance. So by using LL-30, you lower down those chances for a patient to have those things. And a lot of studies really show bacterial species that responds well to LL-37, such as Staph aureus, Pseudomonas, E. coli. So all of those things that are common in our everyday infections, they're very susceptible to this specific peptide.
And of course, this is something for people to talk to their doctors about, obviously, what combination of what different medications that someone would use to get rid of an infection if they need an antibiotic, or if their doctor is integrative or functional, they might suggest peptides, right?
Right. So you mentioned about that's a good point that you brought up there. How is clinical guidance important in the situation, specifically with this one? So, in the study of LL-37, actually has some preliminary studies, maybe I could phrase it that way, that there is some benefits seen in cancers of oral cancer, colon cancer, and even prostate cancer. Unfortunately, there are some studies here that it can actually stimulate other specific cancers, such as breast, lung, and ovarian cancers. Again, these are preclinical data, but of course, as we see kind of smoke, we expect fire, right? So caution still needs to be observed in these specific characteristics of 37. And we all know that majority of our, I guess, viewers, patients, they kind of get peptides from outside, which are basically not medically supervised.
And I mean, not only talking to your doctor or a doctor, maybe multiple opinions, because there's so many different opinions and there's so many different ways to treat things. And doctors have different philosophies and different ways of, well, like integrative and functional and traditional medicine, where they'll give you mostly pharmaceuticals. So you just gotta, you gotta be involved too. Don't you think you gotta be involved in your health with your physician?
Right, right. And again, as part of the physician's role, they need to guide you through, for example, this peptide, if you think about it, it's pretty safe, right? Side effects. So high doses of using LL-37 actually has led to toxic levels in human cells. So we're talking about super high doses here. And then also when you're talking about other autoimmune conditions, it can exacerbate that other than cancer that I just mentioned a while ago, like rosacea, psoriasis, and even lupus flares has been noted. And with gut, there are some, especially if you get the oral form, bloating and diarrhea actually occurs. But who knows if that's because of die off, because of the killing of the bad bacteria. But it has been noted, so just be cautious about that. And some sensitivities, of course, when you're introducing something new to your system, rashes, allergic responses, you have to be cautious about those things. But overall, safety is there. Again, human trials are still ongoing. If you're using topical, if you're using oral forms of this, there are more safety, I guess, measures for that compared or numbers, metrics versus injectables, which is the more common form, as I assume that which is subcutaneous.
So that's injectable with an insulin needle.
Yes, that is correct. So, but you have to remember the different forms, as I mentioned to you, would be creams, orals. There's nasal spray version also, but really the most common is sub-Q.
So what would a doctor, again, talk to your doctor, what would a physician maybe put someone on this for what duration? A month
Like
or
a
2 months?
protocol is that, yeah. So the protocol here really is, so for antibacterial, antimicrobial, you basically do this in a short period of time. So meaning like an antibiotic,
A
like a
higher
seven
dose for a
day.
shorter time?
Well, yeah, well, again, not really, as I mentioned to you, higher dosing. So the difference here would be for acute infections. So you have a daily for 5 to 7 days in a week. And then if the infection is not done yet, you can cycle. So 2 weeks on, 2 weeks off. So, and in general, any peptide, I always suggest cycling. And for chronic infections, you could use this for 2 to 4 weeks in lower doses. So, and again, when I mentioned about using this, you always want it to be adjunctive, meaning when you have you're trying to treat an infection, a massive infection, I wouldn't go for LL-37. I always want to put an antibiotic in there and then add LL-37 on the side. And same for chronic infections. Like for example, you're treating something like of a gut infection. You always want probiotics along with that to work along with LL-37. Though you would notice this is a longer frame of therapy. So 2 to 4 weeks, lower dosing, and also try to cycle it or give your body a rest from that. In other cases, also would be wound skin healing. As I mentioned, is a very potent repair system, and this is topical. And so we're talking about what are the short bursts. Short bursts really are, these are the higher doses, but you only probably want to give this like a day or two, and that's it. And that's how flexible LL-37 is. And you would see later on, I could probably give you some stacks that you can play around with.
So, well, I mean, I think a high dose is what, 100 micrograms? That's a high dose of this, isn't it?
That is, but really it's 1 milligram. That's usually the considered the short burst, uh, I guess, coverage. And then the doses between like 1 to 500 can be your minimal dosing. And again, it also relies on the frequency and how much you give it. So for short bursts, 1, 2 days. Long term, every day, then cycle off for a week and then cycle again and restart. So it's really not only just the dose, but also how often you give it to the patient.
So is there anything else that maybe I missed or you didn't mention that this would benefit?
Yeah. So one thing that we should understand about LL-37 is its dependency on vitamin D. Why is that? Oh, LL-37 production, so let's talk about the natural production of this, is increased by vitamin D. Vitamin D directly upregulates the gene expression, meaning low vitamin D, low LL-37. Adequate vitamin D, stronger innate immunity. Even though we're talking about you giving this externally to a patient, you still want to enhance that because you're producing your own so that the peptide that you've given yourself is not going to be having a hard time working. So other ways to actually boost LL-37 naturally would be exercising, movement. Again, this is something that we always need to address. Any anti-aging protocol has exercise on the menu. Same for sleep. Circadian rhythm matters for immune peptides. So immune system sleeps, more production of LL-37, and our healthy microbiome. The right microbe stimulates LL-37 production. And again, this is a very more of a two-way relationship if you want to understand.
Okay, well, any last thoughts, doc?
Yeah, so LL-37, again, as we always claim, that these are still research peptides and not FDA approved. It's not, again, over the counter supplement, but it's out there, as I know. And it has to be something that we actually have to make sure that we use this in a very safe strategy with your provider. And I have to remind everybody that it's a natural antibiotic, an immune balancer, a tissue repair signal, and a quiet anti aging defender.
Okay, well, as always, we thank you, Dr. Nario, for telling us about LL-37, and we will see you next time.
All right, Steve, thank you so much for having me again. As we all know, that knowledge is power. And thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.